MK Nurse, here to guide your way for exam practice.
Please like the video and subscribe to our YouTube channel for more.
A 72-year-old patient with a history of COPD is admitted with worsening dyspnea. What is the priority nursing action? A. Administer oxygen therapy at 12 min. B. Elevate the head of the bed. C. Administer bronchodilators. D. Assess lung sounds. Assessing lung sounds helps identify any changes or abnormalities in the patient's respiratory status and guides the plan of care. A patient is experiencing chest pain and shortness of breath. What is the nurse's first action? A. Assess vital signs. B. Administer sublingual nitroglycerin. C. Call the physician. D. Obtain an ECG. Assessing vital signs helps determine the severity of the patient's condition and the urgency of interventions needed. A patient with cirrhosis and ascites is receiving spironolactone therapy. What should the nurse monitor closely? A. Blood glucose levels. B. Blood pressure. C. Serum potassium levels. D. Heart rate. Spironolactone can cause hyperkalemia, so monitoring serum potassium levels is essential to avoid potential complications. A patient is admitted with a suspected stroke. What is the nurse's priority assessment? A. Assess the patient's pupils. B. Assess the patient's strength. C. Check the patient's glucose level. D. Assess the patient's speech. Assessing the patient's pupils can provide important information about the severity and location of the stroke. A patient with chronic kidney disease is experiencing fluid retention. What should the nurse monitor? A. Hemoglobin levels. B. Daily weight. C. Skin turgor. D. Serum sodium levels. Monitoring daily weight helps track fluid retention, which is crucial in managing patients with chronic kidney disease. A patient with type 1 diabetes is feeling shaky and anxious. What should the nurse do? A. Check blood glucose levels. B. Administer glucagon. C. Offer the patient a snack. D. Monitor vital signs. Checking blood glucose levels helps determine if the patient is experiencing hypoglycemia, which requires immediate intervention. A patient with a history of anemia is being treated with iron supplements. What should the nurse monitor? A. Monitor hemoglobin levels. B. Check for signs of jaundice. C. Assess for signs of bleeding. D. Check for stool color changes. Monitoring hemoglobin levels helps evaluate the effectiveness of iron supplementation and the patient's response to treatment. A patient has a large wound with purulent drainage. What is the nurse's priority action? A. Cleanse the wound. B. Apply a sterile dressing. C. Administer antibiotics. D. Take a wound culture. Taking a wound culture helps identify the causative organism and guides appropriate antibiotic therapy. A patient with a fractured femur is experiencing severe pain. What should the nurse do? Elevate the affected limb. B. Administer pain medication. C. Apply ice to the affected area. D. Immobilize the affected limb. Administering pain medication helps relieve the patient's pain and improves comfort. A patient with HIV is experiencing night sweats and weight loss. What should the nurse do? A. Monitor vital signs. B. Check the patient's CD4 count. C. Assess for opportunistic infections. D. Obtain a chest X-ray. Assessing for opportunistic infections is important in patients with HIV as they are more susceptible to infections and require prompt treatment. A patient undergoing chemotherapy is experiencing nausea and vomiting. What should the nurse do? A. Administer antiemetics. B. Offer clear liquids. C. Provide small, frequent meals. D. Encourage rest. Administering antiemetics helps control nausea and vomiting, improving the patient's comfort and adherence to chemotherapy. A patient in labor is experiencing prolonged contractions. What is the nurse's priority action? A. Monitor fetal heart rate. B. Check maternal blood pressure. C. Administer oxygen to the mother. D. Reposition the mother. Monitoring fetal heart rate helps assess the baby's well-being during labor and guides further interventions to ensure safety. Cardiovascular. A patient is recovering from a myocardial infarction. What should the nurse teach the patient about activity levels? A. Avoid all physical activity. B. Start a vigorous exercise program. C. Gradually increase activity. D. Only rest and avoid exertion. Gradually increasing activity helps the patient safely return to their normal daily activities while monitoring for any symptoms of overexertion. A patient with pneumonia is experiencing pleuritic chest pain. What is the best nursing intervention? A. Apply heat to the chest. B. Administer pain medication. C. Assist with deep breathing exercises. D. Provide oxygen therapy. Administering pain medication helps relieve pleuritic chest pain, allowing the patient to perform deep breathing exercises more effectively. A patient with Addison's disease presents with weakness and fatigue. What should the nurse assess? A. Blood pressure. B. Heart rate. C. Blood glucose levels. D. Respiratory rate. Patients with Addison's disease often experience orthostatic hypotension. Assessing blood pressure is essential for safety. A patient with a seizure disorder experiences a tonic-clonic seizure. What should the nurse do first? A. Insert an oral airway. B. Turn the patient to their side. C. Restrain the patient. D. Monitor vital signs. Turning the patient to their side helps prevent airway obstruction and aspiration during the seizure. A patient with GERD is complaining of heartburn. What dietary changes should the nurse recommend? A. Increase caffeine intake. B. Eat large meals in the evening. C. Avoid spicy and acidic foods. D. Eat while lying down. Avoiding spicy and acidic foods can help reduce heartburn in patients with GERD. A patient with nephrotic syndrome is experiencing generalized edema. What is the nurse's priority intervention? A. Monitor daily weight. B. Administer diuretics. C. Provide a low-sodium diet. D. Monitor for proteinuria. Monitoring daily weight helps assess fluid retention and guide treatment in patients with nephrotic syndrome. A patient with rheumatoid arthritis is experiencing joint pain and stiffness. What should the nurse recommend? Encourage regular exercise. B. Suggest cold packs. C. Advise complete bed rest. D. Recommend hot showers. Encouraging regular exercise helps improve joint mobility and decrease pain in patients with rheumatoid arthritis. A patient with a history of allergic reactions is experiencing anaphylaxis. What is the nurse's priority action? A. Administer antihistamines. B. Start an IV line. C. Administer epinephrine. D. Place the patient in a supine position. Administering epinephrine is the priority action for treating anaphylaxis to reduce the severity of the allergic reaction and maintain airway patency.